Hi, I am Vipul Malhotra. I'm Aradita's father.
Komal Malhotra, Aradita's mother.
So Aradita was diagnosed with lymphoma, and this was way back in February end, and we were actually referred to Aster by one of our general physicians who had been knowing us for quite some time, and he knew the doctors very well in Aster. The major focus was that since it was more of a pre-diagnosis kind of a stage, and it was a very difficult phase for us because the kid was really in pain, and we were not able to kind of get the diagnosis right. And that's where our physician actually mentioned Dr. Patil's name and his team and the good work they've been doing in Aster RV is where we were kind of interested in kind of having an appointment here in Aster RV. The diagnosis was very quick. To be honest, it was Dr. Patil met us on a Saturday, and the whole biopsy process started on the same day itself. So I think that was one big part which happened during that phase, that we were in the right hands at an initial stage itself.
We really can't thank the doctors enough. Dr. Raghuram stepped in, and it was like a long 2 hours discussion wherein he explained us the entire thing of what this lymphoma was, and the various cases and the issues that we may have. And he literally had a 2 sheet of paper, and he kept pointing out, noting it down, and our questions, our doubts. It was a good 2 hours discussion. But when we stepped out of the room after a 2 hours discussion, we were like, yes, our daughter is in safe hands, and she'll be there. She will lead a normal life very soon. Then it went on, the treatment started. It was the entire team, Dr. Stalin, Dr. Anoop, Dr. Sneha. I just can't thank each of them enough. The sisters who were there round the clock, after the chemos when we were at home, 12 o'clock in the night, if I had to call up any of the sisters who had given their numbers on a personal level and said that if there's anything, ma'am, feel free to call up and we'll connect with the doctors. And it did happen. Suddenly my child getting fever, and we were paranoid what to do. And I called up the doctors. I connect with the sister Anjita, Dr. Sneha, Dr. Deepthi, Sunantha, all of them were like, they have a group there. So if any one of the patient mentions, it's around the group. So every single doctor is aware of the patient anytime and any point of time because of the group, whatever they have internally maintained. But ultimately, it helps us, it gets us that confidence that yes, we are in safe hands. And the treatment went on, the 5 rounds of chemo, along with the prephase, with the guidance of the doctor, every step in that they would actually counsel us, they would tell us.
And I think the biggest part was the way they handled the kid. I think a 16-year-old kid understands all these things very very well, and you can't hide things from them. With obviously the social media, the Google, and everything all around with these kids, Dr. Raghuram, Dr. C.N. Patil, they were really encouraging. They were really kind of supportive. They first look at the comfort of the kid rather than talking about what precautions we have to take, or they were always sure that hey, this is how the kid has to be treated. Like for example, the palliative care which they kind of brought in specifically for Aradita, to kind of guide her through this emotional as well as physical well-being. The fact that pain management is one of the important things out here, and how do you really look out for that, and what kind of treatment has to be going through for that particular period. I think that was really, really recommendable. I think I never thought that this kind of a facility and care would be given. I think they have been really answerable to the patient, and they've been like really responsible. Their accountability has been very high, 24/7. Even after the stages of diagnosis where we kind of said okay, it's the second phase, second stage cancer, and how we kind of really solve for it. The whole the way they kind of guided us, they were very open to kind of suggest that hey, you should do your second opinions, you should do your consults outside also, but once you have decided, let's go with the way. And to be honest, I did do a lot of second opinions. I did consult not only in Bangalore but out of Bangalore, out of India, Singapore, even US, and most of them said that hey,
Knew the team. Most of
they
them
knew
knew
the
the
team.
team.
The
Yeah.
fact is that they knew the team. They exactly knew the kind of treatment we are going to go through, and they actually said that hey, this team, if you are kind of going with this treatment and this team, you're in the safest hand in south of India. So don't have to worry to kind of come towards Mumbai or a Delhi, or you want to go to Singapore or US. I think you're in the best, safest hand, and because the treatment protocols will be the same across the globe. So I think that's where the international standards come into play, which have really been. And in fact, I would say, I would really like to thank Krishna, or even the whole admin team, or the facility housekeeping team in Aster, who have been like 24/7 taking care of us. Any emergency entrance which I have to do, or because the fevers were in awkward times, we had to kind of rush her to the hospital. Every time there was like a proper treatment to us. It was a lot of care, and the way quick turnaround used to happen. Getting the room, getting the things. You have to kind of make the kid comfortable, and then kind of taking it through. I think it was a remarkable service. If I have to really talk about the whole thought process, that hey, the patient is the most important person, and we're going to do all of it to take care of it. And that's where Aster's
Fantastic.
team did a very good job.
See, it's like they say that in tough times, you have your family and you have your friends. I think we built and we have a new family now, which is the Aster team. Thanks to all the doctors, all the staff, all the nurses, and the admin staff who were there round the clock to help us and to make us feel comfortable.
Thank you.
Thank you.